Hi, it's Dr. Pedram Shojai, founder of well.org. A few months back, I was at the Self-Care Revolution in Santa Fe, New Mexico, where I met some of the best doctors in the country who are collaborating on how we can help our patients better. Dr. Angelique Heart and Roy Heilbron, two of these people that I met, who took me in and said, you got to check out what we're doing. I had no idea how profound their work was. They're using chelation. They just finished a study that proved irrevocably that chelation helps for diabetes, heart disease, all kinds of things that we're taking drugs for. If you have anyone in your life that has these diseases, you've got to see this.
Hi, I'm Roy Heilbron. I'm a board-certified cardiologist here in Santa Fe, New Mexico. I was a conventional cardiologist at Mount Sinai in Miami Beach, and over time I continually was shown evidence about chelation, the efficacy, how well it worked, and I started to get more and more involved into chelation. So what chelation does is it pulls toxic metals out of the body. Chelation is FDA approved for lead toxicity, and most people have some element of lead in their body. And when you do chelation, it pulls the lead out, and when toxins are removed from your body, you get healthier.
My name is Dr. Angelique Heart. I'm a board-certified anesthesiologist and pain management specialist. I used to work at the University of Miami VA Pain Management Clinic, where we made an interdisciplinary program for pain management. I did it for 6 years and kind of got burned out, and started to see that just giving shots and giving pills wasn't the way to help these people.
So we just completed a study on chelation. It was a 10-year study, $31 million, sponsored by the government. And we had looked at people who had had heart attacks and who were given all the traditional medicines, plus chelation or plus placebo. And though over the years I had seen improvements in patients who had received chelation, I was very surprised and amazed at how well it presented in the study. For example, like aspirin, that showed an 11% benefit, yet everyone takes it. It was approved. Statins were 22%. Plavix, the latest drug used for heart patients, was 15% improvement, and everybody accepted that. And yet in chelation, the study showed a 26% improvement, and there was all kinds of controversy with that.
So as physicians, we learn actually very little about toxins in medical school. We only learn about acute megatoxicity, but we do not understand, or we do not learn what happens with daily exposure, what happens with accumulation. And we don't see that the underlying cause of a lot of problems actually are caused by toxins. And the fact that people are getting more cancers, or that people are getting more chronic fatigue, more endocrine problems, more autoimmune disease, that to me has to do with the fact that we are exposed to more and more toxins, exponentially more.
We believe the base of almost every disease has a toxic component. So pretty much when you check people, almost everybody has lead or mercury present. And that, those toxins present in your body interfere with all sorts of functions. So the biggest benefit we saw in the study was in patients who had had a heart attack and in diabetics. And these two groups represent the biggest costs in the healthcare budget. And we've now proven a 39% benefit in diabetics, and yet, they're not allowing people to get chelation at this point. What it does is, as the toxins are removed, in diabetics, the dysfunction is that the pancreas can't produce enough insulin. As the toxins are removed, your pancreas is able to recover, and that's really, we believe, how it functions to help diabetics. So for years I was a traditional cardiologist after graduation, and as I learned more and more about alternative medicine and holistic medicine and started to see the data that's really there to support it and started to get the results with my patients, that's why I've completely incorporated it into my practice. It's just simply more effective.
What we practice is functional medicine because it works. It's actually where we get results. We do not have to use other substances that give more side effects. No, we really change lifestyles, we clean up, and we give people way more energy that way, and a chance to really go against a lot of very chronic illnesses and get out of it fast. So by making your changes now, what you'll be doing is you will enhance your vitality, your zest for life. You won't be sitting and living a kind of okay life, and in the meantime slowly getting sicker and sicker, and then you have to go out there and get the fix from the regular medical establishment. There's no need for that. The idea is that we can all live longer with a good brain and be able to do so much more. Really enjoy our lives for the fullest. That's really what we're here for. We're here to learn and enjoy how to live.
So if you're having problems with either heart disease or diabetes or any of the common ailments, please give us a call and we can help you either locate someone near you that can help you, or we also help people through Skype consults or phone consults, or the best is to come out here to Santa Fe, spend a week or a few weeks with us and really heal your disease. This is scientifically proven to be more effective than traditional medicine. And if you're a physician and you're interested in learning this type of protocols, we're very interested in training more physicians, especially in the United States, so this type of medicine can become the medicine of the future. There's a organization called ACAM, A-C-A-M, and if you go to their website and just put in your zip code, they'll tell you of a practitioner in your area that can help you out to get started on chelation.
I oftentimes read the newspaper and think that we would have a far healthier financial system if more people had to face directly with their